So now we will continue with the part 4 of the local anesthetics, as we have done with part 1, 2 and 3 of the local anesthetics. We move to the next slide to start with the part 4 of. Now in this slide we will discuss about the adverse effects of the local anesthetics. When the local anesthetics are applied to the local area or to some nerves, then they produce some undesirable effects which are called the adverse effects of the local anesthetics. First of all, the local anesthetics adverse effects include the paresthesias. The paresthesias especially occurs of face and tongue when the local anesthesia is applied to the facial area. The second adverse effect of the local anesthetics is the CNS stimulation, that is the central nervous system stimulation, which can be noticed in the form of anxiety, restlessness, tremor, and even convulsions. So it stimulates or sometimes stimulates the CNS and leads to the adverse effects related to the CNS. Then the GIT adverse effects sometimes when the local anesthetics are given via the oral route, they can cause the nausea, vomiting, and abdominal pain. Then if large doses of local anesthetics are given, then there is a chance that they may cause respiratory and cardiovascular failure due to overstimulation of the central nervous system. Then if the local anesthetics are applied locally to produce surface anesthesia or infiltration anesthesia or infiltrative anesthesia, then local allergic reactions can occur, which can be observed in the form of rashes, pruritus, and rarely anaphylactic shock. Then at the end, about the adverse effects is the local allergic reactions can also occur if the drugs are applied in a large dose to the local areas for the induction of anesthesia. So these were about the adverse effects, and they should be closely watched because adverse effects, in case of adverse effects, the dose of the local anesthetic should be discontinued. Now we move. Now in this slide we will discuss about the complications of local anesthetics. Sometimes when a large dose of local anesthetics is given, then certain complications can occur with the local anesthetics that might be astrazoamides. The local complication of local anesthetics can be divided into two groups. Number one is the local complication, number two is the systemic complications. In the local complications, if we are going to give the local anesthetic or administer the local anesthetic via the syringe, then the needle of the syringe can break. Number two is prolonged anesthesia can be induced if a large dose is given. Number third is facial nerve paralysis can occur if local anesthetic is applied on the facial area. Number four is the trismus of the muscles can occur, and number five is the soft tissue injury can occur. Number six is the hematoma, that is the collection of blood can occur within the site of injection for the local anesthetics. Number seven, pain or burning sensation can occur due to injection within the nerves or nerve trunks. Number eight is the failure to achieve anesthesia. Sometimes you inject locally the local anesthetic, but the proper anesthesia cannot be achieved. Number nine is the local necrosis. There might be there might be disturbed blood supply of the area where you have injected the local anesthetic, so might be the induction of local necrosis. And number 10 is the post anesthetic intraoral lesions. So these were about the local complications. Now we will discuss about the systemic complications. In the systemic complications, whenever especially the intravenous block, in the intravenous block, when large dose is given, then it may lead to the systemic toxicity. That might be in the form of CNS toxicity, which will be discussed later in our slides. And secondly, allergic reaction to local anesthesia can also occur. That may be manifested in the form of rashes, pruritus, and even anaphylactic shock. So these were the complications of local anesthetics, and care should be taken while administering the local anesthetics locally as well as systemically. So now we will move to. Now in this slide we will discuss about the local anesthetic toxicity, that how we observe the signs and symptoms of local anesthetic toxicity. First of all, there will be involvement of the CNS and the CVS. If local anesthetic toxicity occurs, then there will be involvement of the CNS, that is the stimulation of the CNS, and as well as the CVS, cardiovascular system. The CNS is more sensitive to local anesthetic than the CVS. It means that the central nervous system symptoms will come first, and then the cardiovascular system comes. The CNS manifestations tend to occur earlier. As I've stated before, that the CNS manifestations will come in the form of excitation of the CNS, that is the nervousness, anxiety, tremors, and even convulsions. And the brain excitatory effects occur before the depressant effects. CNS manifestations, I have discussed that brain first of all goes into the excitatory stage, and after that the depressant effect starts. Careful look should be taken of the patient while injecting the local anesthetics, as CNS effects and cardiovascular effects can occur if the toxicity of the drug occurs. So this was about the silent symptoms of local anesthetic toxicity. Now, in this slide, we will discuss about the toxicity treatment. Now, for example, if we have injected local anesthetic, either esters or amide, and local anesthetic toxicity have occurred, then how should we deal with that toxicity, and how to treat the local anesthetic toxicity? First of all, we should treat the apparent allergy, and then we will treat about the CNS toxicity, and at the end we will treat the CVS toxicity. How to treat the apparent allergy? First of all, we will give the steroid in the form of injection. Then we will give the antihistamine or histamine blockers in the form of injections. And with severe reactions, intravenous fluid and epinephrine can be given. So this is the treatment of apparent allergy. Now we will discuss about the CNS toxicity. In the CNS toxicity, we should remember that we don't treat minor reactions. Only we will treat about the seizures. In the case of seizure, we will maintain the airway and breathing, and will provide oxygen to the patient. You will terminate seizure with the gabapental, midazolam, or propofol, and we will intubate patients with full stomach, so that aspiration pneumonia cannot occur. So this was the treatment of toxicity, that is of the apparent allergy and CNS toxicity. Now we'll move to the next slide, in which we will discuss the CVS toxicity, the treatment of the CVS toxicity. So now we move to the in this slide we will continue about the toxicity treatment of CVS toxicity, that how we will treat the CVS toxicity. We know that first of all the apparent allergy occurs, then the CNS toxicity occurs, and after that the CVS toxicity occurs. So how to treat the CVS toxicity? We will first of all substitute imiprazole for lidocaine if the lidocaine is causing the CVS toxicity, and we will replace the vasopressin for epinephrine if we have combined epinephrine with the lidocaine. So this combination should be remembered in order to deal with the CVS toxicity. Now consider the cardiopulmonary bypass or lipid infusion if standard drugs fail. Now if these drugs fail and the CVS toxicity still continues, then we will consider about the cardiopulmonary bypass or lipid infusion in the form of active management of the CVS toxicity. So this was about the treatment of toxic reactions that is caused by the local anesthetics. Now at the end, we will we will discuss about the conclusion of the local anesthetic, that while administering a local anesthetic, we should adopt the local anesthetic technique in a proper way to overcome the difficulties in access and limit soft tissue anesthesia. So a person who is properly trained in the introduction or of a local anesthetic to a person, to a sick person or to a patient, should be there. Secondly, local anesthetic doses must be controlled. You should be well aware of the doses, that which dose is required for a certain type of anesthesia induction, like for the infiltration anesthesia, for the regional block, or for the surface anesthesia. Thirdly, vasoconstrictors produce systemic effects. Here we should talk about the combination of the local anesthetic, that is adrenaline and noradrenaline, should not be every time combined with the local anesthetics, because they produce the vasoconstriction, and they may cause the absorption of the local anesthetics into the systemic circulation and leading to the systemic effects. Then we will discuss that the dental epinephrine has drug interaction. In case of epinephrine injected into a dental for a dental procedure, along with the local anesthetics, has much more drug interaction with each other. Now, then the local anesthesia remains the backbone of pain control intensity in dentistry. Local anesthesia remains the backbone of pain control in dentistry. So this should be noted. And then another point is that research has been continued in both medicine and dentistry to seek new and better means of managing pain associated with many surgical treatments. So it means that in the field of anesthesia, new work is going on, and it is quite possible that new formulations will come across in the future. Now we move. In this slide, we will conclude our lecture now, along with these final 2 points, that painful experiences and poor or prominent surgical scars are the two most memorable aspects of a surgical procedure for a patient. Therefore, the pain must be relieved, and for a relief of pain, we mostly inject the local anesthetics. And the final saying is that if one can provide a nearly painless surgical procedure without the use of general anesthesia, then you have won half the battle. It means that whenever a patient is undergoing a procedure and he is in pain, so the pain must be relieved. The first priority is to relieve the pain, and the pain is relieved by using the general anesthesia or the local anesthesia. And we have discussed the local anesthetics in quite a detail. Now we move to the next slide. So with this, we came to the end of today's lecture, and that was all about the local anesthetics. And hope all the points are crystal clear. So thank you very much.